Tight or restrictive clothing should be removed from the arm. An appropriate size cuff should be applied to the upper arm. The center of the cuff bladder should be positioned over the artery. The cuff should fit firmly and be comfortably secured. The lower edge of the bladder should be 2 to 3 centimeters above the point of the maximum pulsation of the brachial artery. British Hypertension Society recommends that the tubing should exit from the top of the cuff so that it does not interfere with the placing of the stethoscope in the antecubital fossa. The arm should be horizontal and supported at the level of the heart because dependency of the arm below heart level leads to an overestimation of systolic and diastolic pressures of about 10 mercury. Correspondingly, raising the arm above the heart level leads to an underestimation of blood pressure. Before having his blood pressure taken, the patient should remain lying or sitting for 3 minutes. The systolic blood pressure should first be estimated by palpation. Palpate the brachial artery pulse and inflate the cuff until the pulsation disappears, then deflate the cuff. The point of disappearance represents the approximate systolic blood pressure. This avoids underestimation of systolic blood pressure when there is an auscultatory gap. The stethoscope is placed gently over the artery at the point of maximal pulsation. It must not press too firmly or touch the cuff, or the diastolic pressure may be underestimated. The pressure is then raised by inflating the bladder to 30 mercury above the systolic blood pressure, as estimated by palpation. Next, the pressure is reduced at 2 to 3 mercury per second. The point at which repetitive clear tapping sounds first appear for at least 2 consecutive beats gives the systolic blood pressure. The point where the repetitive sounds finally disappear gives the diastolic blood pressure. Blood pressure should be measured in both arms at the initial assessment, particularly if blood pressure appears to be raised